Taping is one frequently used technique in sports medicine. Taping techniques are important for athlete, coach, and medical professionals because they offer support, lessen the pain, and stop future injury. There are different kinds of taping, including general kinesiology tape, kinesiology of edema, and rigid tape. Each of them have different uses and their own advantage. First, general kinesiology tape supports muscle and joints and permits complete range of motion, hence enhancing natural process healing and circulation with its special elastic qualities. The next is kinesiology of edema, which is a specific kind of kinesiology tape which is used to treat edema and swelling, which are frequently brought on by surgeries or accidents. And the last is rigid tape, which is frequently used for joint stabilization because it offers strong support. Now, let's watch a quick demo on how to apply these tapes.
Hi, now I'm going to demonstrate how to use rigid taping for ankle injuries. Firstly, we have to create an ankle wrap, which is by wrapping the rigid tape around the shin without any tension, approximately 5 to 10 cm above the bony ankle, which is to the medial and lateral malleolus. Always make sure to double wrap to ensure that the tape doesn't come loose. Next, pull the rigid tape towards the outside of the ankle, which is known as the lateral side, with a little tension, and wrap it under the foot arch, ensuring covering the lateral side, close to the heel, and around to the inner side of the ankle, which is the medial side. Always ensure to double wrap the tape so that the tape doesn't come loose. During the double wrap, make sure to overlap the first strip, placing it slightly closer to the forefoot. Now pull the tape slightly with less tension and cover the lateral and medial joint again. This is also to apply a heel lock, which is to ensure the heel stability are under pressure. So tape around the front of the foot, slightly overlapping the tape. On the way back to the starting heel, lock anchor point. As we can see in the video, as I'm creating this loop, I am ensuring both medial and lateral side of the ankle joint are both well covered. Once wrapping around the ankle, bring the tape down to the back of the foot, then bring it up again to the anchor point to add extra support. Once done with the looping, you can cut or tear the tape off and seal it. You can also tidy up any loose or exposed tape ends without any tension. Since the rigid tape also is adhesive, you may give it a good rub to produce heat to ensure the sticker is activated. Your taping has completed when you have covered both lateral and medial ankle joint as well as the back foot and the front foot.
Now I'm going to show how to use this general taping on finger using kinesiology tape. First, stretch 50% and cut it into half and wrap around your finger like this. And then repeat the same steps in reverse directions, which shown in the video. This is how we should use general taping on finger by using kinesiology tape. That's all from me. Thank you.
Now I'm going to show on general taping using kinesiology tape on shoulder. First, retract shoulder into a good postural position. Second, for the first strip, tap back 2 inches from end to create your first anchor. Place the anchor on top of the shoulder with no stretch. Peel back paper from middle segment of the strip. Apply tap curving around the back of the shoulder with light stretch. Lay down the second anchor on the outside of the arm with no stretch using the last 2 inches of the tape. Create an anchor at one end of the second strip. Repeat the same techniques as the first strip on the front of the shoulder. Lay down the second anchor with no stretch next to the first strip. Smooth over the full application to ensure tape is completely applied on the skin.
In this video, I will be explaining about the procedure of applying kinesiology tape for the edema on patient wrist. First, I will measure the tape according to the patient wrist, and then I will just fold it in half and then cut it. Next, I will be cutting the edges of the tape. I just fold it over in the middle, and then I will be cutting it in diamond shape using scissor. These diamonds are going to be where the middle and ring finger go. We can put this on by now. But first, I will peel off the sticker first. First, I need to stretch the skin away from the tape. As you can see here, I am applying it, and then we will do on the other side of the wrist. We also need to do a little bit of rubbing. And that is all.
Hello everyone, today I'm going to demonstrate how to apply kinesiology tape for managing edema on knee. There are three materials that we need, which is kinesiology tape, scissors, and also clean and dry skin. So first of all, we will cut the kinesiology tape into 2 strips with the appropriate length. And for each strip, we will cut it into 4 sections, and each about is 6 to 8 inches long. And we will also leave a solid base of about 1 to 2 inches at the top as shown in the video. The next step is we will ensure the skin is clean and dry. So first of all, we will peel off the backing of the tape and apply the solid base to the area above the swelling. Then we will rub it gently to activate the adhesive. The base should be placed without any stretch in the tape. Now, we will apply each strip in a fan-like pattern, and we will gently stretch each strip to about 10 to 20% of its original length and apply it downwards, spreading them evenly over the swollen area. We also need to make sure that the ends of the strips are not stretched and lie flat on the skin. Each strip is applied by following the pathway, and the fourth strip is crossing the other three. Once all strips are applied, rub the tape gently to ensure it adheres well. This activates the adhesive. The tape should feel comfortable and supportive without restricting any movement. And then we will also repeat the same steps for the second strips with 4 different sections that we have cut into. The same steps is apply. We will gently stretch each strip to about 10 to 20% of its original length, apply it downwards, spreading them evenly over the swollen area. And most importantly, we will also make sure that the ends of the strips are not stretched and lie flat on the skins like the first one. Finally, after done taping the kinesiology tape, we need to rub the tape gently to ensure that it adheres well to all the parts of it. That's all.
In conclusion, the use of taping in management sports injuries plays a critical role in providing support, stability to injured areas, preventing further damage, and aiding the rehabilitation process. Effective taping techniques is very helpful and can help to reduce pain, limit unwanted movement, and improve thereby enabling athletes to return to their sports activities more safely and quickly. However, it is essential that taping is applied correctly by trained professionals, which is we are students now. As future teachers, we should learn it correctly and apply it in the right way to the students to ensure it's effective and to avoid potential complications. Thank you.